Hi, I'm Dr. Danielle Marr Collins and I'm Clinical Director of Dermaface MD Skincare and Dermaface Clinic since 2009. So I had a great question today about smokers' lines, and it's really an excellent question because there's three different ways to approach smokers' lines. Firstly, as well, let's discuss how people can have smokers' lines. It can be somebody who smokes, obviously, or vapes. Somebody who never smoked can have smokers' lines, and also somebody who maybe smoked and then gave up. There's a fourth category I as well think that's a possible, is if you're a Botox Karen and you're going around the whole time angry with that face on and pursing your lips. So that's what can cause the smokers' lines, and like I said, you don't have to be a smoker to have them. There's two types of lines to discuss, and smokers' lines are interesting because they're normally both categories. So on our face we can have two types of lines. We can have static lines or we can have dynamic lines. Static lines are lines that are present when our face is at rest. So you might have somebody who's got a nasolabial line here, or marionette lines, or jowls here. We'll do separate series on jowls. But that's a static line. It's just there when the face is static and stationary. Dynamic, by its name, suggests movement. So when I raise up my eyebrows, I have lines here. I need my Botox done. I had some Mohs surgery here, so I'm not really in the mood for needles right now. But I'm aware I need my Botox. Thank you, Botox Karens. And when the time comes, I'll get it done. I don't get this area done. I use my triple peptide eye cream, which I actually just formulated almost for myself because I knew I could deal with that area without... The muscles aren't as strong as they are up here in the forehead. So basically, back to smokers' lines, we can have static lines here, and also when they purse, dynamic. So we have a combination of the two. So it requires a 2 or 3 prong approach. I would suggest, obviously, getting a really good clinician. I'm doing this video so that you're educated, so you know what questions to ask, because I really think that the patients are due and are owed education and have educational value to the TikToks. So the best thing to do is have filler along the vermilion border. The vermilion border is where your lips, the pink of your lips meets, in my case I'm white, the white of my skin, but whatever color skin you have, it's where the pink of your lips meets your skin. So this is the vermilion border. So have filler injected into the vermilion border. If you have a good injector, I tend to be able to pop some filler here and it shoots all the way up the little tube there, and it means you're only injecting your patients either side, and it's much more pleasant for them. Obviously, if there's scar tissue, you'll have to then go above the scar tissue and do bit by bit. Don't get the Cupid's bow done. So that will actually batten down the hatches and stop the pursing of the lips, and it will help stabilize the area. The next thing then is, obviously, if you've got smokers' lines that cross the vermilion border, you can inject a little bit, or your injector can inject upwards, everything up, inject a little bit into the area. And again, it's hyaluronic. So I would suggest that we're mindful that hyaluronic attracts 1,000 times its weight in water. So obviously we don't want to overfill, but again, little bits here. I think I'm going to have to do a part 2 for this, guys. I'll do the part 2 for you right now.